I think it's a good idea to get started. So without further ado, here's Al Lewis.
Thank you, Mark. And some of you have seen our traditional dog and pony show. And this is a little bit about that, but it's also about employee education, a background, who we are and how we deliver these services. And then we will start with the great unveiling, Quizzify To Go, which we will be returning to later in the session on multiple occasions. Who we are. So we are not allowed, for the most part, to list our private sector accounts that range to from about 100 up to many hundreds of thousands. But we can tell you about some of our other partners. We are listed in the book, The Price We Pay. We got a very favorable write-up. Also very favorable write-up in Never Pay the First Bill. We're validated by the Validation Institute. Those of you who know the folks at Leapfrog, we'd encourage you to ask them who their favorite vendor is. We're on the Alight platform. Our stuff carries the Harvard Medical School Shield. Our largest public sector account is New York City, and we can name public sector accounts. Massachusetts cities and towns and Tampa are among them. There is an art to teaching health literacy, and my own personal background has been in trivia as well as in healthcare. And I wrote a best-selling trivia game years and years ago. You can still actually find it on eBay and Amazon. And I used to write and host a couple of trivia game shows in the Boston market. And like every trivia buff who seriously needs a life, I was on Jeopardy once. People ask me if I won, and I say, let me repeat what I said. I was on Jeopardy once. This is the way Quizzify works. Typically, people take 12 monthly quizzes with about 10 questions a quiz. They gain a health knowledge and they become better patients. They make better consumers and better patients. They make healthier decisions and they are able to interact better with the healthcare system. We have 1,700 unique questions covering categories from navigating the medical marketplace, avoiding wasteful, potentially harmful care, how to take pills, how to talk to your doctor, many things about becoming a better patient. And then we have becoming a quote unquote better employee, custom education for whatever benefits you are offering that they might be not understanding. And then to become basically a better consumer of healthcare. We talk about, we have got modules on opioids, alcohol, sleep, nutrition, lots of COVID, plenty of stuff. Now, without further ado, the great unveiling. This is our mobile app called Quizzify To Go. That's designed to help employees when they visit the doctor. You simply download it, and it will ask you if you want to save it on your screen, it will show up with a big cube. And let us actually go there right now. So this has basically two components. One is to make you a better patient at the doctor's office. For, at this point, more than 50 categories. We have questions that you should ask, a little sentence usually, and then questions you should ask with occasional links. These are also in the form of questions, whereas our Quizzify quizzes are a little bit more about getting you some answers. We don't want to interfere with the patient-doctor relationship. We want to improve it. So you don't want to go in and tell the doctor how to practice medicine, even if you're pretty sure you've got some good ideas. There's a saying, don't confuse your Google search with my medical degree. But you do want to direct the conversation to make sure that you ask, and here's another example I just randomly clicked on, to make sure that you ask the right questions for information that may not be volunteered to you during the doctor visit because they're rushed. They may not, they have some people in the waiting room, or they may just not think to answer the questions unless you ask them. It has another component as well, the emergency consent, and we will get to that momentarily. So let's get to the value of Quizzify to you and your employees. And our overarching theme is that employees are going to like this. A lot of people actually use Quizzify without any incentive or with very minor drawings and stuff, because this is not something you have to force people into with money. Not that people don't like getting money. So let's start out with the polling question. Let's talk about, we said that I just made the observation that employees like this stuff. This might be a good example. Let's talk about surprise bills. Do employees like, how do they feel about surprise bills? Do they care about them? No, because you're picking up most of the cost. Yes, but we can't prevent them. Yes, and we help them negotiate them afterwards. Or yes, and we help prevent them in advance. And Mark, I know we had one question come in about this already, actually, before the session, where somebody said they weren't asked to sign anything when they went to the ER, nothing. Does that mean that they are eligible for a surprise bill? And the answer in that case is no. I mean, you can't waive your rights without consenting to it. Most of the time they will ask you to sign a financial consent, and we'll get to that in a sec. Mark, what do we have? Okay, so no, we pay most of the cost. Seems to be an approximate tie with yes, and we help prevent them in advance. I suspect that the yes, we help prevent them in advance folks are in fact some Quizzify customers who are on this webinar. Here is how you do prevent them in advance. There is precisely one way to do it. Quizzify invented this way. You teach employees not to sign their consent. Now they're going to make it very hard to do that. You have to have the ER printed out, and then you write your own consent, which is protected by federal law. It says you write, I consent to responsibility, including insurance, for up to 2 times Medicare, following receipt of an itemized bill for appropriate treatment. Now you can tape this right, or you can put it right on your employees' insurance cards, this is my own card that has a slightly earlier version right here. This is an example of somebody crossing out theirs, writing in ours, and in this particular case, saved more than $10,000 doing that. This is not some theoretical thing. This works 100% of the time for emergencies when used correctly. It's been in the New York Times. We've had write-ups in LinkedIn. Emma Fox wrote how she paid $478 for the single most expensive ER code that there is, 99285, which normally you're paying 10 times that amount. We did a webinar with this guy, James Hamilton, who had his bill reduced by 95.3%. And besides the New York Times, we've just been in Never Pay the First Bill with this exact language. Now here it is. This is right in Quizzify To Go. And actually, I think we'll go to it right here. Now, the important thing is we not only have the language, which you're going to have, by the way, right on your phone when you go to the ER. This is the language, but we don't stop there. We tell people to know their rights, ask to print it out, write the text above, starting with superseding other consents. This is in case you accidentally sign the wrong consent. If they object, take a picture, record the conversation, demand to see a supervisor, remind them that they're required to do this. If they still object, don't sign theirs and insist on being treated. And here's a key thing that much of the content now, probably about 20% of the content in the Quizzify To Go is now user generated. And this was something that was suggested to us by a user. Do not put your social security number down. They don't need that to treat you. They need that to ding your credit rating if in fact you get into a dispute. Now, if your employer uses Quizzify, or if you use Quizzify, there is a 24/7 number that you can call for an expert to explain the relevant law to the intake person. And the conversation will probably start and end with the words, "This call is being recorded." So now that you know this, remember it was about a tie between we don't do anything and we use Quizzify. Let's do another poll to see if the opinion is shifted. So your choices are no, yes, we will use Quizzify to teach people, yes, we will teach them by ourselves, or yes, we will use Quizzify and put the language on their insurance cards. And Mark, while we're waiting, do we have any other polling questions?
Yeah, with the advent of the No Surprises Act, how can you be sure that the prevent consent will still work in 2022?
Okay, that's a great question. This is a classic piece of law trivia here. The No Surprises Act requires you to go to arbitration. In arbitration, you are not allowed to use our 2 times Medicare language. Arbitration is very provider-centric. It specifically says no mention of Medicare is allowed. So you might say, well, how can you do 2 times Medicare if in fact you go to arbitration? The answer is there's something called the 7th Amendment to the Constitution that says that if you don't sign away your rights to a trial, you get a trial. You don't have to go to arbitration. So the key thing is don't sign their consent and you're not stuck in their arbitration. Mark, what do we have?
Okay.
Okay. So it looks like nobody said no. And the overwhelming result is that people will start using this. So we would ask you to get in touch with us. Of course, we're going to be getting in touch with you too. And we will show you the ropes. Okay, so another polling question. Now we're shifting from remember the Quizzify To Go, and for that matter, Quizzify has 2 components. One is to make you a wiser consumer. The other is to make you a better patient. So the question is, which of these do you teach about CT scans? Now we have questions in regular Quizzify about how much radiation is in a CAT scan, because most people don't think there's much at all. There's 100 to 1,000 times as much radiation in the CAT scan. Knowing that turns out to be a big deal in terms of avoiding unneeded scans. So the first question is, which of these do you currently teach employees about CAT scans? Nothing in particular. Use your price finder to find the best price. Call your care navigator, or to be wary of hazards, meaning false positives, radiation, and for goodness sake, doing these things on children. So, so the question is, well, while you're doing that, Mark, do we have anything else coming in?
Well, just to go back to the prevent consent here, what happens if you go into the ER unconscious because of your injuries?
You know, that's a really good question. And to be honest, I don't think it's come up. But if you go in, well, of course, somebody's going to bring you in, actually. So if you went in on your own, if somebody just picked you up and went in, took you in, I don't know if there's anything we could do for you. It's up to your companion to make this work now. So whoever you are with signs the consent. Okay, what do we have here? Nothing in particular. Wins the day. Not a lot of use of price finders, and there are some people who are already using the Quizzify technique of being aware of hazards. Now, there are the thing about scans is that we do absurd numbers of these things in the United States. You can see this is the US versus the rest of the developed world, and we are way ahead of everybody else. I mean, we're 20% ahead of the next highest country here. And there are also all sorts of articles, and we're going to send you this thing so you can click on them, about the absurd number of scans we're doing and how they're harming patients. 30 to 50% of scans are unneeded and may be dangerous, largely because they're very profitable for providers. And Quizzify To Go, back to our new feature, takes what you learn in the app, and it takes what you learn in the quiz and puts it into the app. So this is what you take with you to the doctor office, having learned about the hazards. So now we have another question, and I'll let you read this one off. Mark, do you want to read this one off?
Which of these do you now think is most important thing to teach employees about CT scans? Nothing in particular. To use your price finder, to call your care navigator, or to be wary of hazards, false positives, radiation, and especially with children.
And Mark, while we're waiting for an answer there, do we have any other questions that have come in?
Well, there's a question here about scans. We already have pre-authorization for scans. So inappropriate ones shouldn't be done.
I will tell you that, let me see what I do here with that one. That number that you're seeing of 240 per thousand there, virtually everybody in that 240 was subject to pre-authorization. So this is the number after pre-authorization. So who knows how many there would be without pre-authorization, but pre-authorization is not making a dent in the number, not bringing it down anywhere near the average. So what do we have now for the poll? Okay, all right, yeah, so this is exactly what Quizzify is all about. Once you learn this stuff, number one, you don't forget it, and number two, you put it into place. In fact, probably all of us in this session have either had CAT scans or MRIs we didn't need, or have somebody in the family who did. I personally have had 3. I didn't know about the radiation or anything like that. And every single one of them simply should not have been done. Okay, let's try another polling question. What is your colonoscopy screening policy right now for employees over 50? We pay them to get one or incentivize them to get one every 10 years. We encourage them to get one every 10 years, but there's no money involved. We recommend Cologuard every 3 years, or we do something else. Mark, anything else has come in since then?
Well, on this scanning, shouldn't we start at age 45 for colon cancer screening?
You know, that's an excellent question. And what we recommend is, because I personally have done the math over and over and over again, and it makes absolutely no sense to start at 45. Okay, but I'm not going to tell you to tell your employees that. I would tell you to stay out of the way for 45 to 50-year-olds, okay? Because leave that to the patient and the doctor. The numbers make no sense. The complication rate will probably far exceed the rate of finding actionable new cancers. But, you know, wiser heads than I have said the opposite. Mark, what do we have? Okay, so right now people don't do much. In fact, yeah, so some people are in fact paying, but people aren't doing much at all. And only a few people are using the Cologuard. So let's talk about a different thing that you can do. It's called fecal immunochemical testing, or FIT testing. You simply collect a sample. There's no prep fluid involved. Now, I don't know how many of you are over 50 or 45 and have had this prep fluid, which you have to drink for 24 hours. And all I can tell you is what Dave Barry said about it, which is that I, quote unquote, I don't know what's in it, but it should never be allowed to fall into the hands of America's enemies. Okay, this is much, much simpler than that. You just have to remember to wash your hands afterwards. It also turns out to be more effective. And we have a whole article on this that you can read. But it turns out to be more effective. If you do this, and it has to be done once a year, and in fact, these statistics are based on forgetting 3 years out of 10. So these statistics are based on doing it 7 years out of 10. Your death rate from colon cancer per 1,000 is considerably lower than the far more expensive and invasive colonoscopy, then Cologuard, and then no screening at all. But nobody's really making any money off this stuff, so no one is really pushing it. Once again, we complement our quizzes talking about appropriate screenings with something from Quizzify To Go, where you ask your doctor about what you should do for colon screening. What preparation, what's the complication rate for a colonoscopy? It turns out that it's quite non-trivial. What are the pluses, minuses of Cologuard, and what are the pluses, minuses of FIT? Once again, we know the answer, but we don't want to interfere in the patient-doctor relationship. We just want to guide the patient-doctor relationship. Now that you know this, what might you do? Now, in this case, you're allowed to answer multiple times. So take a shot. And Mark, I'm looking at Q&A. It looks like we got more coming in.
Getting back to the prevent consent, is having a sticker on your card enough to defend yourself?
So far, so good. But if you also sign their consent, we can't guarantee that 100% success rate that we talked about. In fact, you'll note that we added the language superseding other consents to the official Quizzify language. This is what we don't know what would happen if, in fact, you sign theirs and you also give them yours. That's why we urge people not to sign theirs. If you put it on your card and you don't sign theirs, you should be fine. If you put it on your card and you do sign theirs, our 100% guarantee that it will work goes out the window. It will probably still work, just can't guarantee it. Mark, what do we have? What you would do now? Now this came out of the blue. Incentivize employees to get FIT. Okay, yes, that would be a good answer. So what you're watching, folks, is you're watching behavior change on the spot. Okay, now this is an actual trivia question as opposed to a polling question. There is one right answer, and the question is, what tops the total inpatient spending, meaning total, not like an individual case, in the under 65 insured population, meaning the folks that you on this call are responsible for. There's going to be two answers together. So is it diabetes and heart attacks, mental health and substance abuse, diabetes and mental health, or none of the above? Anything new come in there, Mark?
Yeah, getting back to scans for a moment, given that MRIs do not have the radiation level in them, are there any risks in demanding an MRI immediately for back pain?
Yes, actually there isn't, and that is a correct statement. MRIs do not have any radiation in them. The major hazard of MRIs is that they will find things that don't exist. In fact, one person, they did an actual test. They took a person who had a known diagnosis and had already had it surgically corrected. So they knew exactly what was wrong with this person. They sent her to 10 different MRI centers, and she got 49 different diagnoses, and no two centers agreed, and only 3 or 4 of them got it right. So the likelihood of being incorrect is probably the major risk of an MRI, which does not have radiation in it. Mark, what do we have here? Okay, actually, in this case, we stumped the panel. The answer is, in fact, none of the above. The correct answer is musculoskeletal and birth events are by far and away the 2 largest drivers of inpatient spending. This is the top 25 right here, and it leads with, and in color, the color is MSK and birth, and this one is in yellow, ECMOs, because ECMOs can be done on extreme preemies, or they can be done on adults. But you can see musculoskeletal, birth event, musculoskeletal, birth event, birth, and so on, birth, musculoskeletal, birth, and birth. So these are where your money is. This is where you want to focus. So let's look at both of those and see what happens. So the first question is, what's the #1 diagnosis leading to a spinal fusion? Just put your answer in, and I'm not sure we have any new ones, but maybe we do.
Well, actually, when you talk about these top inpatient expenses, in terms of overall spend, how does the spending on chronic disease, in terms of managing that, fit into the overall spend and what you can do with a population health program?
The large majority of spending on chronic disease is not for inpatient admissions specific to that chronic disease. In fact, we just had this happen at a conference the other day, where we were doing a trivia contest, and we asked, per 1,000 people covered in your organization, or as a whole, in the U.S. as a whole, how many primary coded admissions for diabetes do you have in a year? And we were getting numbers, from 10 to 5 per 1,000, from 10 to 500 per 1,000. The answer is 1. Most of your chronic disease spend right now is, in fact, on prevention between the patient and the doctor. If you think about cardio, for example, the heart attack rate is also about 1 per 1,000. but there are a lot of people getting who are on cardiac meds, who are seeing cardiologists, who are on cholesterol lowering meds, et cetera. That's where your money is. So let's see what we have here for an answer. Okay, so the number one diagnosis, oh, wait, didn't we just do this one? Oh, I'm sorry. I'm sorry. I'm sorry. I was looking at the wrong none of the above. What was the answer there, Mark? I just missed it. I think it's failed.
Well, yeah, this is it's a failed spinal fusion is the correct answer for the number one diagnosis leading to a spinal fusion.
And I think none of the above won, but it is failed spinal fusion. So this is one of these things that as soon as employees know, they start becoming better, I'm not going to know whether it's a consumer or patient in this case, but wiser about how they handle their own health. There are all sorts of articles about why spinal fusion rates are growing, even though there's a strong case against them. And the scary thing is they're starting to be done outpatient. So there already are surgeons who are saying, yes, you need a fusion, but we can have you in and out in a day, and make it sound fairly simple. That's not the issue. The issue is what happens in 5 years. And this, or 10 years. And this is where it doesn't matter whether you have an inpatient or outpatient. Failed spinal fusion is still the number one reason for a final spinal fusion. Now, once again, Quizzify To Go will support this. If you look at our back surgery module, you'll see the classic thing in back pain, which is at least 80% of back pain goes away on its own, but 80% of us, including I had myself when I had it, we're quite convinced we were in the other 20%. Well, this means a number of things. This means there are going to be many inappropriate surgeries. It also means that you may have a musculoskeletal vendor who is claiming credit for a lot of what would have gone away on its own. So I'm going to leave that between you and them, but just keep this in mind. And so we have quite a number of questions that you need to ask before you agree to back surgery. And once again, this complements our back surgery quizzes. The key one is, what are the risks of waiting? And the answer is, they will always tell you need to do this very soon. Sometimes you do, but most of the time you don't. Okay, now let's go to the other thing that was high on the list of
inpatient expenses and hospital
expenses. Thank you, Mark. This one is birth events. So the question is, excluding multiple births, what percent of premature birth is preventable? 17, 27, 37, 47. And I do notice a few more questions have popped up. What do we have here?
There is a question about being able to share this kind of Quizzify To Go, the point of service application. If can a user share that with someone if they get a call from somebody? Is that part of our functionality?
Yes, if you look at the bottom of these things, they have a share by email, so you can. It's nice to get an easy question. Okay, so what do we have here for the polling?
Okay.
It's spread all over here. The answer is in fact 17%. It's a very crude method by which so-called singleton pregnancies are designated as high risk. There's some cervical screening and family history, but it's basically been done the same way for about 50 years, I think. Now, it's extremely rare. In fact, it only happens in 2 cases that Quizzify recommends a specific proprietary solution to a problem. This is one of those cases. There is a new test called PreTerm that is the only, it's validated, I can't remember the name of the organization, but it's an FDA FDA subsidiary that validates these things, that's available, that can predict premature birth risk, and take that 17% up to a much higher number that we're about to see. But first, let me show you how it's done. You have to qualify. So if you're going to have a multiple pregnancy, I think you already are essentially automatically considered high risk. And then there are a few other things that you qualify with. So about 88% of people end up qualifying. It's a very simple test. You do it when you actually go to the OB anyway, between 19 and 20 weeks, and you'll know in about 7 days. And it brings the predictive value or the predictability from 17% up to 85%, according to an actual randomized clinical trial, not one of these things where you compare participants to non-participants or anything like that. This is a real clinical trial that was done. People were randomized when they first got pregnant. Some of them got the test. We're in the group that got the test. Some of them weren't. The savings ended up being $863 per birth across all births, with an 85% median reduction in NICU stays. Okay, now it's not just that you save a ton of money, but think about the stress that your employees go through if they have a baby in the NICU. Now, my grandson was in the NICU for precisely 1 day, and we were just stressed. So you multiply that by 10, 20, 30, even 60, even 90, and you can see what you're avoiding by getting babies to go closer to term. Now, it's not just the test. Once you get the test, you as an employer, number one, have to cover the program, whatever program that you choose, but a good program for high-risk maternity management. And if you're paying by the hour, hourly workers should be paid, should not be docked, should be paid for the extra visits they need to make to the doctor or to get the shots that you might need, because you do not want to discourage people from following through on the protocol. Most moms don't need much help, don't need much encouragement if they come out testing positive here. You just don't want to discourage them. You want to make sure that they do what they're supposed to do. Now, preterm and Quizzify have this right shoe, left shoe synergy here, because it's so important to educate employees about pregnancy, about getting the test, about what you do when you're pregnant, that we will actually put 1/3 of our own fees at risk for their performance. So if you have us both in joint account, if you have us both, and for some reason they don't perform, you can get 1/3 of our money back in addition to our 100% guarantees. Sarah, the preterm people, will also put more of their own fee at risk when joint accounts also have Quizzify. So it's a right shoe and a left shoe. I mean, education is critical, as is the test, as is following through, as is covering it, as is paying people for the time that it takes to go to the doctor. Quizzify To Go has 2 pregnancy modules. There are not a ton of questions here because most moms are going to have plenty of questions on their own. What we focus on are the questions that sometimes get overlooked. And certainly this preterm question would be overlooked. So it shows up both in the first visit and follow-up visits. So now that you know this, what might you do? And this time you have multiple answers, okay? So you can answer more than one. Well, you know what multiple means. Would you cover preterm? Would you use Quizzify to teach employees to ask for it? Would you get your wellness or care navigation vendor to understand it? Or would you do nothing, which is what you do today? So, Mark,
have a little trouble launching this particular question, Al. So I think we'll have to just go to the answer here because it's not launching in Quizzify in Zoom.
Okay, it's amazing. This is actually how many months and months and months that we've been doing. This is actually the first time Zoom has let us down. So one would hope that the answers are A, B, and C. So now, having covered the 2 number 1 inpatient things, let's go to the number 1 quote unquote outpatient thing, which is getting cavities filled, trips to the dentist. For every 1,000 people you cover, there are over the course of the year, somewhere around 400 cavities, which makes it much higher than anything else. So the question is, can you fix a small cavity without drilling it and filling it? And your choices are obviously not. Yes, brush it really well with an advanced fluoride toothpaste, or yes, ask your dentist to paint a miracle solution on it. I feel like we've kind of lost the thread on the polling, Mark.
Yeah, I'm sorry, but I'm not able to get this question to
all
work in
right.
the polling right now. It's
Okay.
not launching the.
All right. Well, the answer is that in fact there is a miracle solution that can be painted on these cavities. You don't know about it unless you've been using Quizzify or unless you've seen our presentation. And the reason you don't know about it is that it's extremely unprofitable for a dentist. So you basically have a choice here. You can use a technology which is a century old, or you can get silver diamond fluoride. And here's the way it works. The dentist puts one drop on what's known as a micro brush and brushes it on the cavity, and the silver diamond fluoride essentially freezes the decay in place so it doesn't expand. It also preserves some of the enamel because the cavity, when they fill it out in a kind of a concave way, or maybe I mean convex, whatever. They fill out, they take away some healthy enamel so when they put the filling in, it doesn't pop right out. So they end up drilling a lot of enamel you don't need to drill. In the case of this, you save all the enamel for, in case something happens down the road. This is not us with some wacky alternative thing that no one has ever heard of. I mean, well, I know people have not heard, but that is not legitimate. This has been approved by the FDA for 7 years. There have been all sorts of articles about it. This one from the Today Show, silver diamond fluoride can stop tooth decay with one drop, no drilling required, actually came from us. They learned about it from Kaiser Health News, and which learned about it from us, and they had it on their show. It takes 5 minutes, it costs 30 or less, and there's no needles or no drilling involved. Now, normally, Mark, and Quizzify To Go covers this too. And this is one where, we said we want to enhance the patient-doctor relationship, but this is one where you really have to be directive. This is one of the few cases where you're really almost telling the dentist what to do, because the dentist is not going to want to do this. They're taking a $100 to $200 visit and turning it into a $25 or $30 visit. So we have it for kids and we have it for adults. Now, for kids, the thing you should know about it is that the dentist, the American Association of Pediatric Dentistry, requires dentists to at least mention this option about your kids. And yet, when was the last time one did? Now, for adults, the pushback you're going to get is that it's going to turn your decay black, which it will. That is a downside. However, number one, I mean, most cavities, oh, hey,
Yeah,
we got it back.
Yeah,
except now we know the answer. Right? Okay.
All right, well, it's back though.
Yeah. The pushback that you'll get is that it's going to turn your decay black, but most adults, the fillings, the cavities are way in the back of your mouth anyway. And also there is, and they won't tell you about this either, a solution called potassium iodide that will considerably lighten the black spot. I mean, it won't get all the way back to white, but it'll be pretty close. Okay, Mark, do you want to wrap this part up?
Yeah, I'm just going to take a minute here and ask our participants to just consider, Al has just highlighted 6 really good health literacy topics that do provide some really nice value to employees. And when we talk about this prevent consent, just consider the value of saving just one employee from a $14,000 ER bill that, like we just did, actually bringing it down to $670. That really brings a lot of goodwill. When you talk about these medical scans, Al and I present this question, and I'd say at least 80% of the benefit managers don't know the amount of radiation in a CAT scan. And with our simple point of service, simple non-pushback questions right on your phone, people can really start to make better decisions and also in many cases avoid significant costs. Spinal fusions, people look for quick fixes. They'll go to their GP, get referred to the GP's friend who's an orthopedic, and they'll go to an outpatient facility and end up with one of these very expensive and not always the best choice surgeries, meaning the spinal fusions, when the conservative therapy is almost always a better choice. So just education there can really make a difference. Al just talked about the value of this test for premature delivery. Tremendous value to the newborn's health. value in preventing stress for the employees, parents, and also benefit to the payer because this happens to be one of the largest claims. And lastly, there's no secret on the treating these cavities in the sense that this SDF is really non-invasive, less expensive, and painless. So just consider how your employees will really appreciate this sort of knowledge, and there's more.
Yeah, actually, before we get into more, we're kind of switched roles here. So I'm the one who's reading the questions off. So a couple things. First, don't put them in the chat box, put them in the Q&A. That way, if we don't answer them now, we'll answer them later. The second thing is somebody commented that their father had stage 4 liver cancer and they wanted him to get a spinal fusion. And the other question that we got is, why doesn't the company that makes the silver diamine fluoride simply advertise direct to consumers if the dentists don't want to do it? And that one has a pretty obvious answer. Actually, it wasn't pretty. It took me months to figure it out. The company that makes silver diamine fluoride is called Elevate Oral Care, sells about 30 or 40 things to the dental profession, all of which either enhance the revenues or allow them to reduce their costs without dinging their revenues. And this is the one thing that they sell that reduces dentist revenues. If the dentist found out that, which they would, if they were advertising directly to the public, something that was actually going to hurt the dentist, they would simply switch to a competitor of Elevate Oral Care for everything else. Let me see, I got to just nix out of the Q&A here and nix out of the chat box. Oops, there we go. Now, we're just giving you a few little examples here of what Quizzify did in the category of becoming a wiser patient. We also cover a ton of other stuff, a ton of everyday stuff. For instance, heartburn. We have 2 modules on heartburn because we call it the most common voluntary ailment that you can have. One way you can avoid if you have nighttime heartburn is simply incline your bed. I have books under my bed to incline it. This is a slightly fancier method. You should get a second opinion. Mark, do you happen to know offhand? I seem to recall that some huge number of second opinions differ from the first one.
Yeah, there was a study done by Walmart. Walmart found that with their complex cases that it was above 50% in terms of the diagnosis not being complete and accurate. And another study done by the Mayo Clinic had an even higher number in the sense that they only found that 12% were truly complete and accurate when they were complex cases. And this is something that is a little scary when you first read about it, but unfortunately, diagnoses can be incorrect. And making employees aware of this and then teaching them how, if they are going to get a second opinion, what's the best way to do it, can be very valuable. I mean, in essence, that's the reason that this whole Center of Excellence program got going at Walmart, because they realized misdiagnosis was really causing a big problem. And by setting up a much better program in terms of getting the diagnosis straight with the Center of Excellence, it had much better outcomes and actually ended up saving them a fair amount of money.
And different people do different things. Well, we can tell you the one thing as a patient you shouldn't do is just knock on the door of the doctor in the next office, because they have to see your doctor every day, right? So your odds of getting an honest second opinion that contradicts the first go way down. Taking Advil or applying ice to a sports injury is actually going to slow the healing. This is not to say you shouldn't do it, but just keep that in mind. It actually turns out that taking Advil during the day, maybe it's taking it at night, but I can't remember which. It turns out that you can take it either in the morning or at night. I'll have to look up which it is, without slowing the healing. But because most healing, I think you can take it during the day because most healing takes place at night. Crunch, if you see the word crunch on a cereal box, it means corn syrup. So Kellogg's took Raisin Bran, which is perfectly innocuous, slightly sweet, to my mind, quite delicious cereal, poured corn syrup into it, and the new version dramatically outsells the old version. Stents, they're still doing it at the same rate they've done them for the last 10 years, even though it's been proven they have no value. So Quizzify covers that, and Quizzify To Go covers that. If you're still taking a baby aspirin, unless you've had a heart attack or you're very high risk for a heart attack, those can do more harm than good, because if you're in, for instance, an accident or you have a GI bleed or something, it can be much worse if your blood's not coagulating. And then something as simple as sleep. You know, you'll hear from a lot of folks, quite correctly, I might add, that you want to sleep in a dark room that's quiet and cool and everything, and that's all right. But then there's some other things that you probably didn't know. And one of them is if your bedroom is full of those very common energy efficient bulbs, they may very well be keeping you awake because they give off much more blue light. Mark, back to you to talk the health risk assessment. Okay, great.
Now, what you see on this slide here is a side-by-side comparison, and we're going to start with where do you think you're going to get an honest answer? And a traditional health risk assessment, not all of them, but some of them will ask questions like you see on the left there about feeling depressed or how much you drink or if you use recreational drugs. And, you know, my question to the group is, do you really get actionable data from this? And can you really produce a good report? When you talk about how much people drink, if you look at the numbers you're getting, if it's not 70% of people that will admit that they drink and the 10% that drink more than they should, if you're not getting numbers like that, you're probably not getting good answers. So what we're thinking and like to suggest that maybe there hasn't been an alternative, and these are often used in lieu of by completing a health risk assessment or by completing a number of Quizzifys, you'll get a discount on your insurance premium. But potentially, you know, offering Quizzify, which is actionable, tangible, is inclusive for all levels of knowledge, and you're really providing real value in terms of the healthcare and benefits advice. As you know, we just discussed a whole bunch of examples that Al went through. So what we're just putting forward here is that maybe this is an option that an employer might want to, you know, look at as maybe something that's the next generation to what is a traditional health risk assessment. In the sense, it's wellness that's offered rather than done to employees. And the next slide is a follow-up question that we wanted to put forward to the audience.
So which do you think employees would like better? The trivia games, the health risk assessment, are both about the same? And while we're waiting, did anything else come in?
Well, you know, with there's quite a few sections in the Quizzify To Go. And how do you find the section that might be relevant? Is there a search function or something when you're in front of the doctor?
For these, you know, we're getting a lot of hard questions. Ask us again in a week. We haven't added the search function yet. It requires adding keywords and the function, and that functionality should be up in a week. Right now, it's alphabetical and has to be scanned. Or there's actually a function that allows you just to look at the whole list before you go through them all. But in a week, we'll have a search function. Mark? Okay, so yes, so it is definitely the case that these games are quite popular. Now, it does happen, if to the third point, that we just actually, or we actually was our client, did a survey, and while Quizzify did very well, quite a number of people, about 30%, said that they were both valuable. If in fact you are using a prime wellness vendor, really, really good wellness vendor, they have kind of gone through these health risk assessments and taken out the cringeworthy stuff and put in some good things. So we were fortunate, or depending on how competitive we were either fortunate to be in an organization that had a fine wellness vendor, or unfortunate to be in an organization with a fine wellness vendor, because we would usually win about 10 to 1, and we only won about 2 to 3 to 1 with a lot of ties. These are examples of wellness vendors that we recommend and we work with and we think are perfectly great. We give first prize to U.S. Preventive Medicine because in addition to working very well with us. They are validated by the Validation Institute for their outcomes. They actually have moved the needle on risk reduction, which puts them in the small minority of wellness vendors, noticeably moved the needle. Here are a few others down here that we're very fond of and that we can put our name behind. If you can think of some others that we might have missed, we're happy to talk to you about it and interview them and get them, you know, to see if they're quiz worthy. So let's talk savings. So there are three reasons that Quizzify can produce immediate savings, and immediate's in quotes because it's not going to happen today, but it certainly should happen much sooner than with other vendors. Lower ER bills, more detection of cancer, avoiding harmful overtreatment, or asking doctors and dentists the right questions. So Mark, did anything else come in? The search question we will get back to everybody when we have the search function up.
And a question here is, where are we getting these questions to ask a doctor?
Oh, we get them from multiple places. It's actually not, first of all, a lot of them just flow right out of our quizzes. But it's actually not that hard to find the questions. What makes Quizzify To Go unique is a couple of things. One is that the quizzes tie to the Quizzify To Go app and vice versa. So you're educated when you go in there and then you know what questions to ask. But number two, very simply, it blows our mind that no one has ever thought of this before. Putting all the questions to ask the doctors for all the common visits in one place to have with you when you go there. Okay, so what do we have? Okay, so there are a few folks who said more early detection of cancer. No, early detection of cancer is not something that we're hugely good at. Now we do, with the FIT test, we'll detect cancer sooner, but the number of people who get colon cancer is in a given year is quite low. So, and once they get it, you have to treat it. So we certainly would not count that as savings, and everything else is absolutely yes. And this is an example of how, and you just saw it. I mean, we just saw here how the needles move on attitudes and behavior changes across a wide variety of, of issues where you thought one thing, and then we just completely changed your mind on a bunch of things. This happens all the time. This was a large survey done across many cities and towns in Massachusetts. A classic way to put your finger on the scale in a survey is just to survey people who finish whatever it is that you gave them to do. In this case, they sent it to all registrants, everybody who had ever registered, and they still got great results, but they also found that they actually did move the needle on people accessing the healthcare system as patients. So let's show you how much all this stuff saves. Okay, so we're gonna, and this is validated by the Validation Institute, so we're not making this stuff up. Our ROI calculator allows you to enter in your own company, the own number of people you have, how much we cost, and it's about $12 to $14 a year, has multiple categories, and you can actually go in and you can change any category. So this is just the ER billing right here. So ER billing, you have about 180, maybe even actually slightly fewer. So I'm going to change it to 160 right on the spot. About 160 ER events a year. Your current cost is at least $1,800. We will basically promise and guarantee to save you at least $1,000 a visit. Right now we're running $3,000 or $4,000 a visit on the ones we know about. Probably 3 out of 4 people aren't going to manage to do this for one reason or other. They may be unconscious, or they may not be willing to, they may not have taken the quizzes, they may not have the app with them, whatever. So we're only saying 1 out of 4 people is going to manage to get this right. And even so, the savings just from this one item of $40,000 swamp the Quizzify cost. And now let's get into what the cost is. So I'm going to ask you, how much do you currently pay for your wellness program? And Mark, while people are filling that out, I just got to keep an eye on the time here. I think we're good.
Well, Dudley asked if we're going to make a recording available, and everyone will get a recording in a follow-up email tomorrow, about 24 hours afterward. It'll be a full recording of what we do today, as well as all the slides, and the links and all the slides are live as well. So you can get, for example, you can get right to our ROI calculator. And Al, another question would be, we saw that we have defaults listed in the calculator for numbers of scans or pricing on scans. Where did we get that information? Is it footnoted so that people can see where we got the data in terms of standard inputs that they can also change?
Yes, every one of the default inputs is sourced to a live link. Okay, so what do we have here? We got a lot of virgins on this one. And also people are paying a good price for this, including the screenings. Let's, and we would love to, we would love to be, for you to build your wellness program on our platform, with us. And in a future month, we're going to incorporate some of these award-winning vendors that we've talked about and show you how you can put everything together. Quizzify is inexpensive. If you're in a regular range of per employee, number of employees, it'll be $10 to $14 a year, with 100% savings guarantee if you have over 1,000 people, or 100% engagement guarantee at any number of lives. And you can mix and match these two. And right now, Quizzify To Go is free because we frankly promised it to a bunch of people for free. But if you don't sign by 1/22, we are going to be charging for it. There's a fair amount of cost involved, especially the 24/7 coverage for ER. Now, just checking the time here, we may run a minute over, but let me just tell you about the engagement guarantee very quickly. We are the only vendor that actually gets paid to demo to groups. That's how you know we're engaging. When we go to a conference, we either get a free booth or we get money. Every other vendor pays for the booth or they pay to speak. That's because Quizzify is engaging. But you don't have to take our word for it. Just watch what your users do. 90% or more will complete a quiz they start. 20% are power users that we'll talk about in a sec. They trust our shield, and we guarantee, as we mentioned, there's a tool that you can use to measure engagement. Most importantly, no personal health information, not most importantly, but this is one of the reasons we get good engagement, is we respect employees. We're not going to be asking them for personal health information. This is from mass cities and towns. They have a very, very high quiz completion rate. I want to focus on the power user rate. Usually it's about 20%. These are the folks who, after they've played a quiz, say, that was a great quiz. I'm going to play it again because I might have missed some stuff. And there's no financial benefit whatsoever in any program to doing this other than the learning. Our corporate engagement is since 2018, we have a 100% renewal rate of every account, where more than 15% of employees have played the first quiz. The only exception to that is Phillips Exeter Academy, which you might know is the alma mater of Mark Zuckerberg or Dan Brown. And they are still a reference site. So even the people who dropped Quizzify are a reference site. And we're kind of out of time, but Mark, do you want to just?
I'll just make a couple comments here. It really is very simple to get Quizzify up and running, and we'd be happy to walk you through how we do that. We have such a great quiz completion rate of over 90% across the board. We really focus on explaining and promoting Quizzify so that people are aware of what the Quizzify is when they get the first quiz. You can actually go to that QR code that's right on the page here. That's one of the ways that we help people get to Quizzify. You can actually put your phone up to that right now, and you'll get to a sample quiz. And I also wanted to mention that our app has become sophisticated enough that we can handle groups of 75 and more. As Al mentioned, we work with companies that have several employer groups of several hundreds of thousands, but we can now accommodate smaller groups as well and make it economical. And we're going to have something in the future that'll be almost self-serve. So we'll be able to go down to groups of at a 10 to 25. But right now, any group over 75, we can offer cost-effective pricing. And then I'll stop there because I know we're short on time.
Yeah. So ask yourselves, is there any other line item where every employee gets an unlimited budget, but no training on how to spend it? Are your employees engaged in health and healthcare and their health benefit? And a final polling question, and most people have stuck with us. Would Quizzify be a good way to teach employees healthcare? No, because our employees already know this, maybe, or yes. Now, of course, this is, we don't know what the answer is going to be. We suspect we'll get 70% yeses, but let's see if we're able to move the needle here. And Mark, we probably just should get right to the poll and not, yeah. Okay, so I said 70 and we got 87. Would love to talk to the maybes as well. And I think that wraps us up. So thank you very much, everybody. And to start out, just write to us, ask for a sample quiz on any topic, ask us for Quizzify To Go, whatever you like. In the immortal words of the great philosophers at Staples, yeah, we got that. All right, and that's a wrap, everybody.
Thank you. Bye now.